All right, good morning, everyone. Thanks so much for letting me hijack just a portion of your agenda this morning. I am here today to present this year's recipients of the Debbie Goeller Excellence in Public Health Award. So for many of you who may or may not know Debbie Goeller, I just want to tell you a little bit about her. So Debbie Goeller was Worcester County's health officer and trusted public health leader for over 25 years. Her vision and what she accomplished over her years of service continue to shape the future of the Worcester County Health Department. Her persistent and focused leadership paved the way for new programs and specialty services that continue to be offered by the health department. She was a champion for public health services, and her dedication to the citizens of Worcester County was unwavering. In 2020, the Debbie Goeller Excellence in Public Health Award was created to recognize exceptional performance by individuals identified by their peers for having excelled in public health with integrity and a strong commitment to the community and population health of Worcester County. At this time, I'd like to recognize someone very special to the health department family. I'm going to wave to the camera. I'm pleased to share this podium in spirit today with Debbie's daughter, Mandy Goeller. Always, even from the West Coast or from a boat somewhere out in the Pacific, Mandy has always been a part of our annual award. Mandy, I don't know if you know this, is a captain with the National Oceanic and Atmospheric Administration and currently is serving as NOAA's Atlantic Fleet Commanding Officer. Big titles. Duty calls, and unfortunately Mandy cannot join us today here in person. She's in Mississippi, seeing in a ship's crew that has been internationally deployed for the last 3 months. And Mandy and I have been emailing back and forth for a while now, and she said to me, as I know my mom would have told me to go to the crew. That's where she would want me to be. So I'd like, Mandy shared some things she'd like me to share with you all today. Each year, the awardees for the Excellence in Public Health Award in my mother's name continue to impress, exceed my expectations, and are truly exceptional people. This year is no exception, and it is even more special to me specifically. My mother not only valued excellence in public health, but also partnerships between groups, divisions, agencies, government, non-government organizations, anything that will make the project success and expand to reach more citizens. This year, awardees are a perfect example of this synergy. The local EMS services have always played an exceptional and necessary role in our community. This group recognized a community need for our aging population and wanted to do even more than they already do for the community, so they reached out to serve within a certain program. Try not to let the cat out of the bag. As Worcester County is small, most people know each other, I think many of you would know that this is such an extra special year to me, especially for one of the awardees, which I'm not going to name right yet. I'm going to skip that because she names a lot of names. And it all probably also means each of you worked too many hours and put your patients first always. It's a blessing to call one of the recipients a friend, and it's an honor to have each of you be recognized with the Debbie Goeller Excellence in Public Health Award. My mother is proud of you. Thank you for all you do, and please keep up the inspiring work. And that was from Mandy. I'd like to take just a minute more too, if you would indulge me, because this year's nomination was just so well done. And those that submitted it really did an outstanding job highlighting the work of the recipients for this year. So the need for a mobile integrated health program in Worcester County was recognized by hospital and county agency leadership, who had vision of improved health and reduced hospitalizations for Worcester County residents. Worcester County Fire and Emergency Medical Services, EMS agencies, also saw the value of this vision, partnership, and potential success in improving patients' health in their own communities. In February 2021, the Worcester County Mobile Integrated Community Health Program commenced, providing an effective community-based care coordination program to reduce high emergency department and emergency medical service utilization while improving the health of the community. Because this program is a true collaboration of agencies, this multi-agency, multidisciplinary partnership further strengthens the relationships of community providers serving the aging Worcester County population, thus building an extensive network of care for Worcester County residents. The 12 Worcester County Fire EMS agencies are a key component and contributor in the successful collaboration. The value of EMS clinicians to the Worcester County community is priceless. In their emergency responder role, EMS clinicians respond to urgent, acute medical needs and implement life-saving measures. The inclusion of EMS as a partner of the Mobile Integrated Community Health Program is vital for program success. Worcester County EMS clinicians are viewed as trusted professionals throughout the rural communities and have built close relationships and ties with these communities. They are often the first to encounter a community member with medical needs and present an opportunity to engage high-risk individuals into a path of improved health. The EMS clinicians in Worcester County are key partners in the implementation, delivery, and success of the MICH program. Mobile integrated health programs allow EMS clinicians to embrace an expanded role varying slightly from the traditional emergency responder role. EMS clinicians move from providing emergency care to identifying healthcare needs and service gaps and connecting patients to preventative services, thus furthering their role as community advocates. This designation is to nominate 5 outstanding Worcester County paramedics who excel in their field and pursue an additional opportunity to make a difference in the community. And they're naming the nominations, which I'm not going to do quite yet. These nominees are being nominated for their exceptional performance in the Worcester County MICH program and for serving as an integral part and extension of the Worcester County EMS community. The MICH paramedics have embraced an opportunity to make a difference in additional capacity beyond emergency 911 calls. This nomination is not related to a specific patient encounter, but rather for their ongoing quest to improve the health of our and their community. They are blazing a path in Worcester County as difference makers, helping to educate, serve, and strengthen our community. The MICH paramedics have proven their outstanding dedication to the success of the MICH program, but most importantly, to the improved health of each and every MICH patient. They have each embraced the opportunity to foster a partnership with every patient to work towards improving the patient's health and well-being. To every home visit, they bring remarkable ability to put patients at ease, to literally get on one knee, look the patient in the eye, and exhibit a deep empathy towards their situation and challenges. Exhibiting compassion and explaining the situation in understandable terms, they gain the patient's trust, thus enhancing the program's ability to provide quality of care and help the patient reach their health goals. This skilled communication also extends to family members and loved ones of MICH patients who are also frequently in need of support and guidance in the context of shared goal setting. The MICH paramedics' dedication to our patients does not stop when their MICH shift ends. They often follow up with patients and families off the clock when they recognize that someone may be experiencing a particularly challenging situation. These dedicated paramedics do not stop with patient care. While they promote the program with their own EMS agencies, they also provide program and resource education to other Worcester County EMS clinicians, often helping them navigate challenging EMS calls where social issues and challenges may increase the complexity of the situation. Again, in the capacity, they do not limit themselves to specific hours, but instead have made it known to Worcester County EMS community that they are available to field questions and calls and to serve as important sources of information at all times. Their exceptional competence. Each of the Mitch paramedics consistently ensure the provision of quality services to each and every patient. This team has sought out opportunities to visit and learn from other Mitch programs, to identify best practices and incorporate into our program. They are able to draw upon extensive medical knowledge and synthesize and adapt the information to meet the learning needs of patients, thus serving to empower the patients and in their medical care. Many patients have the goal of remaining in their home, and the paramedics' safety assessment and accompanying recommendations and interventions help to meet the patient where they are and address their priorities. The Mitch paramedics seek out and embrace opportunities for continuous learning and growth and are committed to serving the public and bringing health equity to all corners of Worcester County. Though the goal of Mitch program is to reduce high utilization of EMS services and emergency departments, often by connecting patients with preventative care and services, there are situations in which patients seen by the Mitch team require immediate emergency medical care during a visit. The Mitch paramedics are the key decision makers in these situations, helping to identify when someone is in need of immediate care, communicating with local EMS, and facilitating the smooth transfer of care to responding EMS team. Their knowledge and skill in these situations cannot be overstated or overvalued, and enables the patient to be in a much safer situation to receive Mitch services moving forward. Integrity. The Mitch paramedics practice with compassion and integrity. They approach every home visit as an opportunity to make a difference in their patients' health and safety. Their respect of our patients and their families is evident in the care they provide and the way in which they serve, and is critical, important skill, particularly given the vulnerabilities of many Mitch patients. They also hold their EMS clinicians to the same high standard and foster a collaborative culture amongst the EMS community. The Mitch paramedics have recognized the value of individuals receiving preventative care and stabilizing their lives to help break the cycle of crisis. They are able to identify and respond to individual patient needs on a micro level and use that information to identify gaps in services and possible ways to address those issues on a macro level. This passion for identifying and reducing the health disparities of high-risk community members inspires confidence in the program, thus positively influencing engaging other EMS clinicians working in our county to make referrals for individuals in need of assistance. Through this focus on reducing health disparities and addressing social determinants of health, the Mitch paramedics engage in extensive prevention activities at the primary, secondary, and tertiary levels, all tailored to the specific needs, situation, and goals of the patient. Excellent service. The Mitch paramedics represent public health completely in their EMS and Mitch service capacities. As emergency responders, they serve and promote best practices in EMS care. As Mitch EMS clinicians, they provide exceptional performance, practice with humility, and always act in the best interests of the patient. They assess for medical and social health needs, address healthcare gaps, and provide linkage to community resources. Their patient advocacy and benevolence work to promote, protect, and enhance the health and safety of our community. EMS clinicians are trained to save lives. However, being part of the Mitch team required the learning of new skill sets for each Mitch paramedics. Each of the team embraced and continues to seek out and utilize opportunities to learn about community resources, disease and injury prevention, and promoting healthy lifestyles. Thus, in these roles, they have become ambassadors for improving the health of the community and an important extension of Worcester County, Maryland Access Point. Mitch has given the paramedics a tangible means to take further action beyond helping patients with their acute health needs. Leadership. These paramedics may not sit at the helm of their agencies, but they are true leaders in their field. As peers, they provide guidance and inspire our EMS clinicians to further efforts in patient care. They help EMS clinicians throughout Worcester County to identify more vulnerable adults resulting in adult protective service referrals, identification of situations where the crisis response team is needed, and helping to discern which programs are most appropriate. They demonstrate leadership within their own EMS agencies and throughout the county as they foster relationship building and communication between EMS clinicians, hospital, providers, and social service agencies to promote an active and engaged network to support MITCH program activities. This promotion of teamwork and agency collaboration inspires confidence and motivates partners to advocate for patients in need of service. Throughout the state of Maryland and nationwide, there is a changed perspective of the role of emergency medical service clinicians. The implementation of a mobile integrated health program enables community members and leaders to see the value of their preventative skills in addition to their emergency care skills and improves the quality and delivery of care by EMS clinicians. Worcester County's MITCH EMS paramedics work as part of a multidisciplinary team to bridge community resources, education, and healthcare services to improve the health outcomes of Worcester County's high-risk community members. See why I wanted to read it? Was that not outstanding? So, ladies and gentlemen, if you could please help me in congratulating the 2024 Debbie Goeller Excellence in Public Health Award recipients, plural, to Harvey Booth, Sean Sullivan, Evie Rode, Maria Burdan, and Alex Lasley. Congratulations.